Today we're here at Marine Drive Medical Center. We will be speaking to Dr. M.Y. Adam, who will be giving us some background on the drug Ozempic.
Good day, Dr. Adam. Thank you for availing yourself for this interview.
No problem. Thanks for having me.
Recently, there's been talk of this drug called Ozempic. It's known as a wonder drug to the youth and to other people as well. They've been using it for weight loss purposes. What is it exactly?
Okay, so you're right. Ozempic is definitely known as the wonder drug right now at the moment. In South Africa, it's been used currently off-label, right? Off-label means it's not prescribed to non-diabetics. It's not supposed to be. So this drug basically will make people lose weight very rapidly. And yes, it is the wonder drug. That's what they're calling it, the wonder drug.
Okay. And if I was interested in getting Ozempic, how would I go about it?
Like I was saying, Ozempic, you need to see your doctor. You can't just go to a shop and go and get it over the counter. You have to see your doctor. He has to assess you and prescribe it for you. And if you're not diabetic, you're not going to get it because it's, like I said before, it's used off-label, meaning doctors are actually prescribing this thing illegally for people to lose weight.
So its initial purpose was for diabetes. Can you tell me more about that?
Initial purpose is for diabetic patients. So Ozempic is basically used for diabetes. We're giving it to our diabetic patients. It will basically mimic a hormone, right? And basically those hormone levels will rise and they send messages to your brain. And they tell your brain that basically, I'm full and you don't have to eat more.
So it lowers the appetite?
It lowers everything, yeah, the appetite and everything.
And what exactly would you say are the side effects of using Ozempic for purposes other than diabetes?
Look, I don't agree with it. Like I said before, doctors are using it off-label. There are side effects. There are some bad effects to Ozempic. Yes, Ozempic does make my patients lose a lot of weight, right? But there are also side effects. There's issues with gallbladder problems, pancreatic problems, nausea, extreme nausea and vomiting. But still, some of my patients will still get it from some other places as well, and they'll still take it because everybody wants to lose weight.
And what has been your experience with prescribing Ozempic to patients with type 2 diabetes?
With the people who are diabetic, it's been an amazing drug. It's really reduced cardiovascular problems. It's reduced renal problems. It's turned people's lives around. For diabetic patients, it's definitely a go-to drug. It's really worked well. It's in South Africa, and I encourage all my patients who are not doing well on oral treatment to try and see their doctor and try and see if they can do Ozempic.
With your patients that have diabetes and they're being treated with it, have they come back to you just for the drug so they can lose weight?
You mean the diabetic patients? Yeah, some patients do. Well, they hear about the wonder drug. They're thinking, why not? I'm diabetic. Get the effects of all this plus lose weight. Yeah, they do. A lot of them do.
What would you say are the risks of using Ozempic over long periods of time, not just with type 2 diabetes patients, but also the people that just want to lose weight?
So with the people that are type 2 diabetic, definitely they lose weight, they benefit from it. It's a go-to drug. You can continue it for a very long time, right? Unless you get some kind of ill effects from it. Say you're allergic to something. That's the only thing I can see. But if you look at your non-diabetic patients, you're looking at a lot of adverse effects that come back. So some patients have had something called Ozempic facies as well, where basically the actual face actually hangs because of the amount of weight loss they have. And let me tell you something, Ozempic works for weight loss, but it's not legal to give it for a non-diabetic patient.
Is it healthy for, you're saying that it has a lot of effects, right? So, but is it healthy for diabetic patients, like however long they have to use it for?
Yeah, perfectly safe. Perfectly safe. We monitor the patients with blood tests every 6 months. We see how they're doing, and it's fine, safe.
What are your final thoughts or recommendations that you may have for other healthcare professionals or providers or patients on using Ozempic as a treatment?
I would say consult other specialists involved for a patient first if you want to prescribe it for a non-diabetic patient. Maybe there's a patient with obesity and has a problem that needs to lose weight for an operation. Maybe we can look into prescribing it for a patient like that. But for my diabetic patients, it's straightforward, and I think basically just make a good decision about it. Don't prescribe a drug just for weight loss. That's not legal in South Africa. It's not right.
Okay. Thank you so much for helping us understand.
Not a problem. Thank you so much.
And that is all for the educational background on Ozempic. My name is Haley Mate for Caribou Sauce.